Cases of respiratory virus RSV are just surging among Michigan children, and hospitals across Metro Detroit are really struggling to keep up. Paula Tutman has a close look at just how serious it is and how the health systems are trying to keep pace.
I've been talking to hospital groups all across the metro area, and I'm being told at this very moment there are 0 pediatric ICU beds available. 0. Hospitals are telling me they are inundated. No pediatric ICU beds available in the entire state of Michigan. That's according to Dr. Matthew Denenberg, chief of pediatrics for what used to be Beaumont but is now Corewell Health East, which has 8 hospitals in the metro area, including Beaumont Children's.
I'm on a call weekly with all of the children's hospitals and children's health services across the state of Michigan, and we're all full.
Right now at Beaumont Children's alone, there are 17 children in the ER waiting for a bed to get into ICU.
They're coming and going out of those rooms, but we really are, as a state, working together in all of our hospitals trying to find beds for these kids.
RSV has come back with a vengeance after 2 years of separating and masking. Researchers are trying to find out why this year it is earlier and seemingly more virulent. But the fact of the matter is, regardless of the why, says Dr. James Sutton, who represents 5 McLaren hospitals in the metro area, including Flint and Lapeer, these facilities don't admit pediatrics. They do stabilize incoming children and infants. And so this is an issue.
Those children that are the sickest that we initially receive and care for in our emergency department that would require admission to the hospital would be transferred to another local pediatric specialized hospital.
Dr. Scott Grant is with DMC's Children's Hospital.
They're pretty miserable when they get to us and they need some oxygen therapy, just try to keep their lungs open. Some of them need some IV fluids because they're not able to drink quite well enough. Sometimes they're coughing so much from this infection that it's causing them to have some vomiting, and so they're not able to stay hydrated, so they need some IV fluids.
But also important to dial in with your general practitioner or regular pediatric healthcare provider to determine if there is the need to go to the ER. Dr. Dennis Cunningham is with Henry Ford Health, which has 5 acute hospitals in the metro area and Jackson.
It's probably time to break out that mask if you're going into a big crowded area, you're going shopping. It's really important if you're very young, very old, or you have any medical issues. And again, it's not too late to get your flu vaccine and your COVID vaccine.
So children under 2 are particularly vulnerable because they've got smaller organs, smaller windpipes that collect more mucus, smaller lungs that need more support. But also keep in mind, older children can get this as well as elderly people with comorbidities. Paula Tutman, Local 4.
Well, there is a small bit of good news on the RSV front. Experts say we may have a vaccine by next fall. 4 vaccines could be nearing review by the FDA, and more than a dozen others are in testing. A long-acting injection designed to be given right after birth is also in the works. In a recent clinical trial, it showed 75% effectiveness in heading off infections that required medical attention. RSV was already the leading cause of infant hospitalizations in the U.S. even before this year's surge.